What about a scenario where using tissue testing is not going to be helpful for the patient, either because you don't have enough biopsy tissue at all, or they've only received a diagnostic, for example, fine needle aspiration, and you would have to go back and get an additional biopsy? In those scenarios, a liquid biopsy actually would be reasonable. Tumors shed DNA into the circulation, and the ability to test that DNA for molecular alterations has become a very valuable tool. However, there are some limitations. First of all, we know that only tumors that are active are those that are shedding the DNAs in sufficient quantities to be able to be tested. So a tumor that's been receiving chemotherapy, or a patient that's been receiving chemotherapy, that tumor shed rate may become very low and you may not pick up anything. So it's best to draw that tube of blood for the patient for the liquid DNA testing, even before they start therapy or while they're progressing on a certain line of therapy prior to the next line of therapy. Additionally, we have to be aware of the fact that certain tumors are just less prone to shed DNA than others. We know, for example, that cholangiocarcinomas, the use of liquid testing can become very valuable because those tumors tend to shed DNA. Whereas in pancreatic cancer, the DNA shed rate can be actually relatively low. And so the sensitivity of picking up an alteration might not be as high as we would like, certainly not as high as we see with tissue testing.